any problems at the surgery itself?
Some of the issues with regards to the waiting room, patients are saying that glass barriers at the reception desk, they found actually produced a barrier between them and the receptionist. They felt that it was sort of cutting them off. Many practices still do have glass barriers. Others have a much more open reception area, and the patients seem to find that much more friendly and made them feel much more comfortable. In terms of confidentiality, some people found it very uncomfortable because conversations were easily overheard within the waiting room. People actually wanted to speak to the receptionist in a confidential way, but there was nowhere for them to do that. They could overhear conversations of other patients, they could overhear telephone calls being given, and they felt very uncomfortable about those issues of confidentiality within the waiting room themselves.
What kind of suggestions did patients make?
There were several quite interesting stories that came out of the focus groups and how people's experiences with a single person had differed in different primary care premises. One was somebody who had moved practice and has had a really, really positive experience in one practice, moved to a different practice and found a really negative experience. This wasn't somebody who was just a born complainer. This was somebody who actually could understand something really good and had come across something really bad. Again, there was another patient who visited one practice as a patient and another practice as a carer, and again came across quite differing qualities of service in these two environments. Again, not a born complainer. This was somebody who's picking up something really, really good in one place and some really perhaps less than good in another place. And I thought they were really, really telling stories to show there is obviously a diversity of care within primary care. But I think it's important to understand that what we're trying to do is not produce uniformity. I mean, one of the strengths of primary care in Wales is its diversity. What we're trying to do is encourage flexibility and for us to develop services which are patient-centred, that what we define what we do is all about what the needs of the patient are, and that's what's going to make a service a really gold standard service, we feel, is that patient-centredness, understanding those needs.
Did the patients have concerns related to seeing the GP?
Well, I'm not going to surprise you when I say that time was one of the main concerns that people had, was having time with the professional they were seeing so they had the opportunity to go through all their issues. This is a long-standing problem, and it partly comes back to the things we were talking about appointment books. People would like to feel that they had the opportunity to book longer appointments if they knew there was going to be a problem that was going to take more time. And again, this is unsurprising. They wanted somebody who listened. Again, all the studies they've been looking at quality of care over many decades in primary care. It's people like someone who listens to their concerns and takes them on board and acts on them. So those aren't anything new, but the fact that people are still telling us these things means that we're not getting it quite right yet. So people liked that concern, that they had a meaningful discussion. Didn't like the fact that the doctor was very quick to reach for the prescription pad, that the doctor hadn't really explained about the medication, hadn't explained about side effects. These, again, were threads that were brought out quite repeatedly. Carers' issues, that was another thing that came up, that often we were very, very concerned about the patient themselves, but appeared to not take into account the views and the needs of somebody who was caring for them. And caring for somebody with a mental health related problem can be extremely exhausting and really, really demanding. And so, again, we need to be thinking about the issues of carers.
So what suggestions came out of the patient panels?
The patient panel suggested a whole raft of ideas, and we're going to go through these in a minute, and it's going to seem like an exhausting list. But and I think if you start looking at it, a lot of it isn't actually very difficult or very expensive or time-consuming to do. Yeah, we need to make sure that our appointment systems are flexible, that they're usable for patients, that they're not themselves actually creating a barrier to access. So there need to be different ways of making appointments, not just one way. I mean, you can make an appointment by telephone, by text maybe, by email. A carer or a friend can make that appointment. We need to make sure that these appointment systems work for patients. We need to remember that patients are expressing this unhappiness about being asked intrusive questions by reception staff, and so for reception staff to be sensitive about the fact that patients may not want to give up that information, and so just to be careful in this area. It is important, obviously, to collect some information, but just respect patients' need for privacy in this area. We need to be flexible about how we deal with people. We all have rules. Rules are really there for guidance, and what we need to make sure is that people feel free to exercise sound judgment in these areas and not be rigid. Flexibility and diversity are really what we're looking for in this area. And then going back to the waiting room, if it is possible, think about developing a quiet area or somewhere where people can sit, having other ways for people to wait. Could they wait in the car so that they can be called in when the appointment's available? Have you got this safe way out for patients who are distressed? Is your waiting room friendly? Is it welcoming? I mean, is the whole experience for people going to reduce their levels of distress as opposed to increase it? You have to remember that if you have a single system for doing something, it's not going to serve everybody. So like call systems within the waiting room, you may need a flexible way of calling people in, not just relying on, say, a buzzer or a visual display board. Remember, say, people who are hard of hearing or visually impaired may not be able to use those services effectively. Think about transport. How easy is it for your patients actually to get to the surgery if they're reliant upon public transport? Are the surgeries running at times when the buses are actually turning up? When dealing with people who are often highly anxious, very, very distressed in waiting rooms and in surgery, just remember how much empathy and care is needed in dealing with them. We need to make sure we reduce their levels of distress and they feel comfortable. The issues about training. I think GPs, as professionals, we need to make sure that, as part of our continuing professional development, we're really concentrating on making sure our knowledge and understanding and skills in the area of mental health are kept up to date. Many of us haven't refreshed our knowledge since perhaps our days as medical students. And again, for practice nurses, they need to be considering the fact what their educational needs are in the terms of mental health. Because I think we all understand that practice nurses do spend a lot of time doing mental health related work, even though perhaps it's not called that. As I hinted at before, complaints can be a really valuable way of actually collecting information about what we're doing badly. I've also explained that patients often don't want to complain. They feel uncomfortable about complaining. They understand how busy and difficult our lives are, and they don't want to make a complaint that might affect their future care. So we have to make sure that our complaint systems are usable and friendly to people, and that we do our utmost to try and gather complaints, because that's a really, really valuable way of learning. And also other ways of collecting the experience of our patients. We are filling questionnaires once a year for QOF, but we need to make sure that perhaps we're doing other types of exercise to collect patient experience, even patient support groups, to actually help educate us about where our services aren't really working very well. And finally, I want to go about stress, mental health needs. I think it's something that affects us all, and I think it's something that collectively within our surgeries, within our teams, we need to be thinking about is what our own mental health needs are. Because if we can't look after ourselves and our staff and deal with their stress and mental health needs, what hope have our patients got? So I think it's something we can think about collectively as a team, as actually how we do deal with our own distress and anxiety and the stress we deal with in our working lives.
This looks like a very long list of improvements that we might need to make.
It does seem like a huge tranche of work, but I don't think you're going to find, if you start sitting down and discussing this as a team, actually there's anything really too difficult within this. This isn't rocket science. And in many ways, a lot of you say, well, I knew that already. But if we know it already, why are patients still telling us that it's a problem? And they're telling us it's still a problem because it slips. We know what we should be doing a lot of the time, but it doesn't quite work. And that's because, yes, our lives are busy, our lives are complex, but we're hoping that start thinking about those hallmarks we talked about at the beginning, about trust and communication and thinking about the needs of patients.